Take Back Your Health Now, Episode 98. Information contained in this podcast is not medical advice. It is for educational and informational purposes only. Please consult with your doctor before making any health choices.
You're listening to the Take Back Your Health Now podcast, the show that interviews the top doctors, athletes, trainers, and entrepreneurs to help you find the holy grail of health. Now here's your host, Dr. Dan Margolin.
Hi, this is Dr. Dan Margolin with another segment of Take Back Your Health Now, where we pull out all the stops in search of health's holy grail. We're very excited today. We have Dr. J.W. Nielsen, MD. He has 38 years experience as a family physician with special emphasis on pain management, patient education, research, urgent care, and emergencies in medicine. Dr. Nielsen's interest in pain management started in 1981 when he found himself the only physician in Erie County who would see workers' compensation spine injuries. In 1993, he moved to Bluffton, Ohio, and started training in alternative medicine with Dr. Chappell and began his work in Prolotherapy and Chelation therapy. Doc, we're going to have to ask you about that too. In 1994, with Dr. Chappell's assistance as president of the American College for Advancement of Medicine, Dr. Nielsen started the first contract research organization specializing in complementary medicine, herbals, supplements, product validation, and medical outcome trials for chelation therapy. In addition to clinical practice, Dr. Nielsen initiated North Coast Clinical Research, one of the nation's largest research centers specializing in clinical trials in family practice. He's participated in 34 nationwide trials for the development of new drugs. Dr. Nielsen was the host of his own radio show for 13 years. This 2-hour talk show was designed originally to overcome the blood shortage caused by the early AIDS epidemic. After the 10th anniversary of the show, the American Red Cross awarded the Good Neighbor Award for his work. In 2010, Dr. Nielsen was trained by ILADS as a Lyme literate physician by Joseph Jemsek, MD, in Washington, D.C. And today we're going to be talking a little bit about Lyme disease. Dr. Nielsen, welcome to the show, sir.
Thanks. That introduction made me tired.
My God, you have done a lot of things, sir. My God. So we are so excited to have you on board. I had actually listened to you on some other shows talking about Lyme disease, and I was so shocked about it. And even in my podiatry practice, I've seen patients come in with Lyme disease, and I've seen people that have so many different presentations, from patients that are just lethargic. It's just all over the spectrum. And so it makes it difficult from my perspective to actually diagnose it. And when I heard you speaking about it, I needed to have you on the show. And maybe you could just give us a little history of how you got involved in this, and we'll go from there.
Well, a decade ago, I diagnosed Lyme disease in a patient, sent her off for her Western blots. They came back negative, and I told her she was wrong, and I redirected my efforts. She went back and did research and came back and showed me that the tests were not accurate, and asked for a referral to an infectious disease specialist who lived a couple hours away. She saw him. He called me up, told me I was right, asked me if I would take over the care of the patient, and she recovered. And that patient went on to make it her life's mission to feed information to me.
Wow.
And that made me start seeing a few patients, and just the word that I would treat Lyme resulted in people coming at me that then overwhelmed me. They all knew more about Lyme than I did. And she started visiting doctor after doctor in her effort to get better, and every doctor she went to did something different. She ended up with a PICC line, then she ended up on herbs, then she ended up on the Douglas coil machine. And each one of these things seemed to have its feature, but was not holy grail. And so finally I found Rosner's book on alternative Lyme therapies, and I started doing colloidal silver and the Douglas coil machine, the Cowden protocol, salt C.
So what is the Douglas coil machine?
It's a machine. Every living thing on Earth has an electromagnetic frequency that is very toxic. we happen to be microwaves, and which is why cell towers are killing us.
Right.
And you can tune the Douglas coil machine to kill the pathogens in Lyme. I
Wow. So
found
it's
it
not like
very expensive and very uncontrollable.
okay. Wow.
And so all of this was happening, and I was contacted by a woman from LDUC, one of the support organizations for Lyme, and she raised the money from a donor to send me to Washington to study with Dr. Joseph Jemsek, who, in my opinion, is the greatest Lyme doctor in the country.
Hmm.
And I went up and studied with him for a week, 12 hours a day, and came back. And now I was even more uncomfortable because he was way out of my skill set.
Mm-hmm.
And I started doing some studying, but didn't change my treatment much. And then I ran into a woman on the YouTube by the name of Eva Sapi, S-A-P-I, and she was talking about biofilm, biofilm. It's the
Okay.
tartar on your teeth. Unfortunately, you have biofilm throughout your body when you have Lyme disease, chronic Lyme disease, not acute.
Okay.
And I started working with nattokinase, the digestive enzyme you take on an empty stomach to break down biofilm. And
Okay.
I had patients get better just from doing that. And then I really redirected my life over to my current protocol, and I've now been doing that for the past 6 years.
So, so this biofilm that you're talking about. So you're saying that with Lyme disease is these bacteria or whatever they release this kind of a film that protects them. Is that correct?
Correct. Here's what's going on. The Lyme disease was very easy to treat in 1980 when it was discovered in Lyme, Connecticut. You just gave 2 weeks of doxycycline, the patient got better.
Okay.
That bug is a spirochete, Borrelia burgdorferi. It is the largest bacteria on Earth. It looks like a parasite. It has a flagellum and a spike, and it drills through tissue. Its nearest cousin is syphilis.
Oh
And
wow.
right, and studying spirochetes will scare you to death. Okay, they're all bad bugs. And
Now the spirochete, it's a spiral. That's where the word comes from. It's
correct,
almost like a corkscrew. So it
right. Looking them up and seeing them scares you to death.
wow.
And so this bug has many chromosomes, and most bacteria have none. And all of its chromosomes are dedicated to immune evasion of discovery.
Oh wow.
Well, then we had another bug in the community called Mycoplasma fermentans. And when it got into the tick and met Borrelia burgdorferi, kind of like two guys in prison teach each other their skills, they traded information, and Borrelia Lyme was permanently changed and became extremely resistant to therapy because it learned how to make biofilm. So it backs up against bone or a foreign body like a artificial valve or the root canal in your teeth, and then it covers itself in a scum. And
Huh.
now the white blood cells can't see it, they can't find it, and antibiotics can't get in.
Oh my God. So you're saying this thing has evolved since 1980 to become more evasive than ever.
Oh, by 100-fold.
A
We
hundred.
no longer believe you can be cured of Lyme. We only believe you can be controlled. And my experience is true. The few people in my practice who haven't listened to me have gotten completely well, have totally relapsed.
Wow. Well, let's talk about this then for a second. So you had mentioned before, you said there was an acute Lyme and a chronic Lyme. So are these states that it evolves into the acute? In other words,
Correct.
they
What
are.
happens is Lyme goes through a series of steps. The day that you're bit by a tick, you have 24 hours to get that tick off of you, and then you're going to be infected.
Okay.
And I can't tell you why 24 hours is important. There's a lot of theories on it.
So wait, Doctor. So if you see a tick on yourself, can you just pull it off, or is there a
Well, there
specific
are tools to take it off. You can buy tick removers. They cost $1, and I suggest all people own one because you can't wait for Amazon to bring one.
right, right.
And you want to remove it correctly, and you want to save the tick because you may want to test it later. Okay, and
Okay.
then you now have been infected. Well, if you let me know that right away, I can put you on a couple antibiotics for 21 days and you won't get chronic Lyme. You'll be cured. Okay. But if you miss this infection for 6 to 12 months, you will develop biofilm. And your Lyme test, like the Western blot, will go negative because the biofilm has covered up the antibodies, and
Oh my
you will
God.
miss your diagnosis. And now you're into my chronic Lyme therapy and you have to treat biofilm plus antibiotics.
Okay. So, Dr. L, so let me just get this. So you get bit, right? You remove it 24 hours. Then what are the antibiotics that you should be on for I always honestly thought that it was doxycycline for 10 days, but you're saying it's a much longer period than that?
It is. It's not Doxy anymore because it's now $700, and we can talk about the corruption of healthcare later.
Okay.
But minocycline also works and is affordable. And
Okay.
another drug that I like to use is clindamycin, which is extremely toxic to Borrelia.
Really?
And you can also add a cephalosporin, but never use cephalosporins like um, Omnicef or Rocifen alone because that makes the bug go cystic. And now we get into this 6 months. Now, what happens is what happens when you have it for 10 years? What happens when your mother had it and you were born with it in the placenta? Now you're going to go into a third stage and you're going to develop cysts in your brain. And that's a
Oh
whole
my
nother disease.
God. So this is you said earlier that it's similar to syphilis. So this is actually, and I didn't know this, a sexually transmitted disease as well.
It can be. It is certainly a pregnancy transmitted disease. I believe I've seen one case of sexually transmitted Lyme. It has been documented that it can occur, but it's rare. Our question should be, is it transmitted by anything other than ticks? Because 15 years ago, the CDC published a study showing that bed bugs transmitted 15 different known diseases.
Oh,
And then a year ago, they put out an article that said that bed bugs aren't known to transmit any diseases. And I went,
huh.
sure, right. They really got dumber, you know. And so I'm very concerned about the role of bed bugs in Lyme disease now, but have nothing to prove.
Now are you saying are they not just not wanting to panic people about this? Because it does seem like there are people that are getting Lyme disease that are not out in the woods. Do you know what I mean? That's
Correct.
always it baffles me because I see
Well,
these
one
people.
of the problems we're having is that we decided to tell people this was from deer. It is not from deer. Deer are one of the vectors. The true vector is migratory birds, and they transmit the infection to the white-footed mouse, which is the mouse that lives outside your house. Okay? And
Yeah.
so that means that you have a bird land on your windowsill in the summer, that tick can crawl in your house and get in on you. You don't need a deer. You
Okay.
only need a migratory bird.
Wow. That makes so much more sense because I could never wrap my wits around it. I said, how many people are out in the woods? And it just never made sense to me. So thank you for clarifying that.
I wanted to spend a little bit of time talking about some references people can use if they'd like to know more about Lyme.
Please, please.
There is a wonderful uh, article that just came out on the 26th of October by NBC that is a 5-part series. And if you put in the internet, the Lyme Wars hyphen investigating a public health crisis, you'll see NBC has an incredible coverage on it. I haven't gotten to watch it all yet, um, but it really is quite good. Another thing that people want to watch is Under Our Skin. It's on YouTube. It won an Emmy Award. It's actually the story of my mentor, Dr. Jemsek, losing his license along with another doctor because of the Infectious Disease Society of America wanting to stop Lyme doctors from treating Lyme. It's very educational.
Unbelievable.
I, ju-
Unbelievable.
I just watched a really interesting video by Jane Markey, M-A-R-K-E, and M-A-R-K-E, MD, and if you put in mental illness or Lyme disease, question mark, Jane Markey, It was a presentation to the American Psychiatric Association about the fact that she believes that a large proportion of people with mental illness in America are actually Lyme disease. I agree. I cure schizophrenia, bipolar disease, panic, all kinds of things all the time in the process of treating Lyme.
Oh my goodness,
And I
Doc. So,
think that's important to know.
I had a patient that came to me and he said exactly what you just said. He said, you know what? I get these kind of symptoms, and he was describing them. He goes, and when I tell my doctors that, they think I'm crazy. He said, and they've referred me to psychiatrists, psychologists. He goes, but I'm telling you, it's Lyme disease. And so, just hearing you talk about that, and he actually started talking about going to another country for stem cell injections and things like that. Could you just go into like the workable therapies, the current therapies, the therapies that people
Let's
may or may
cover a
not?
little bit of testing because
Sure.
there are things that you can do that are going to help you learn if you have Lyme, some of them even without a doctor. The first
Okay.
thing is people should go up on the web and go up to VCS test, VCSTEST.com, and they will find an on the computer eye exam. The retina of the eye is very sensitive to Lyme disease. So it's also very sensitive to black mold. We haven't talked about black mold. 20% of my patients who I think have Lyme turn out to be black mold.
Wow.
And so this is a test that you can save online and monitor your progress. Another thing you can do is you can go out and buy very high quality nattokinase. You can buy online a product called Nattozyme by Designs for Health. That's my best product I've found. And start out taking a 16th of a capsule twice a day for 2 days, then an eighth of a capsule twice a day for 2 days, etc. And if you get up to a quarter to a half a capsule and you become worse, you've been opening up your biofilm and having a Herxheimer reaction. And there are no explanations for why a digestive enzyme would make you sick except
Hmm.
that test. Okay.
So
And
this is a test. So
that's
you're
my
taking
first
it.
step in all Lyme therapy is to get people on the dose of nattokinase that makes them feel bad but doesn't make them dysfunctional. You can also test it with stevia. Stevia is a biofilm cutter. Now, stevia is a terrible poison. No one should ever eat it. It causes prostatic cancer, irritable bowel syndrome, vertigo, arrhythmias. Um, I got my PSA to go from 2 to 29 in 6 weeks when I took a supplement with stevia on it. Stopped it, and in 8 days it dropped to 6. I have 47
I'm like
people.
stunned, Dr. Nielsen. I've heard stevia. Like I know the other ones are horrible for you, but I thought stevia was the alternative sweetener that was actually good for you. But you're
No,
saying,
read the book Stevia Deception. It's by the man who wrote the coconut oil book, and it is excellent. It's about all sweeteners. Stevia is the most dangerous sweetener yet because all of the alternative medicine and nutritional people are now putting it in everything. I had a guy who they rolled his blood pressure pill in stevia to make it sweet, like he's a puppy or something. It's
oh my
crazy.
God, oh my God, this is so
His
crazy.
PSA dropped from 16 to 5 when I changed his blood pressure pill. So anyway, you can use stevia to test it, but it's not a consistent Herx reaction, and I don't recommend stevia
What
anyway.
would the reaction be if you took
It's more
stevia?
of what you already have. If you have Lyme and you have brain fog, the brain fog will get worse. If your joints hurt, your joints will hurt more. It's just more of your disease.
Okay, okay,
And so the other thing you can do is you can do some very limited lab. If you can get your doctor to send you to LabCorp, you want to get two tests. And I only do two tests originally, other than basic lab, on Lyme patients. I do a CD57. This is a measurement of the immune cells that are available to fight Lyme. And if you come in under normal, you either have that or black mold or something else I haven't figured out yet. And the other
okay.
test I always do is a TGF1 beta 1, and that's the test for black mold. And if that comes back elevated, then I want people to go out and talk to a mold abatement person and have their house tested. I cannot tell black mold from Lyme.
Wow. Okay. Okay. Um, and black mold is something that is fairly common.
It's getting so common, it's incredible because it was in found in some kid in Cleveland is a little shop of horrors in his basement about 15 years ago. But since then, we've gone through a recession. People haven't fixed their roofs. And if they've had a wet basement or a soffit leak or a bad bathroom and they have gotten mold in their house, that mold statistically now will be Stachybotrys or one of the bad molds. And
Hmm.
those things, you are breathing in neurotoxins that are giving you symptoms that are just like the neurotoxins of Lyme.
Unbelievable. I tell you, I don't think this is very well known, Doc. I
It
mean,
is not.
it is not, right? Wow, wow. Any other ways of testing for this?
Well, you can go to the really big expensive labs like iGenex and Fry, and their lab is quite accurate, unlike the stuff at a traditional lab, but it's very expensive. And in the end, it's all like 80% accurate. My nattokinase test is 80% accurate. My thing is, if you go to a traditional ILADS doctor, you may spend $100,000 getting better. Most of the people who come to me are already bankrupt because they
Oh,
can't work and their insurance didn't cover their health bills. And I'm treating most people for $2,000 or $3,000. I'm putting people on nattokinase and then I'm putting them on Green Dragon LB Core herbal antibiotics. It takes me 6 or 7 months to work up on those two until I'm on maximum doses. Once I do that, the patient is about 40 to 50% better. Then I continue the nattokinase and I put them on alternating day, alternating week, triple antibiotics and migrate up through 8 antibiotics. And at the end of that, the patient is better. And
wow.
so I'm only taking 12 doses of antibiotics a month. This isn't like putting a PICC line in and giving 5 antibiotics every day of the week, twice a day.
Okay. Is that the normal? Like, is that what they would do?
That's what a lot of ILADS doctors would do. Joe Jemsek revolutionized Lyme therapy by figuring out that if you give antibiotics constantly, the Lyme just goes to sleep and waits you out. If you give antibiotics randomly, alternate days, alternate weeks, and bring the doses up slowly, the bug doesn't see the antibiotic coming and then it doesn't put up its defenses and you can kill it.
Got it. So, and you're using maybe I'm right, the nattokinase to break down that slime layer,
Correct.
open it up, then you hit it with the antibiotic,
Correct.
and then you start to kill it out. Is there a point when you can actually stop the person
No,
from being on?
because no one's cured.
No one's-
Everyone who stops relapses. People um, have either need to stay on LB Core or they need to stay on Monday, Wednesday, Friday antibiotics once every 12 weeks for life.
Okay. Wow, this is a real killer disease. Let's say somebody that is not treated at all, or let's say they do relapse. What's the final outcome? Is it
Well, they'll be diagnosed by their traditional doctor with Lou Gehrig's disease, multiple sclerosis, fibromyalgia, chronic fatigue syndrome, depression, psychosis, whatever is the specialty of the specialist, they will diagnose it with whatever they diagnose, and then they will give cortisone, which is a great way to test Lyme because if you have Lyme and you get cortisone, you will get much worse. If you
wow?
take an antibiotic or cortisone and have a terrible adverse reaction that makes you worse, you should think Lyme.
Well, Dr. Nielsen, what percentage of people, if you were to guesstimate right now in this country, have Lyme disease?
ILADS says we have 40 million undiagnosed cases.
40 million. So you're looking at about 15% of the
Yep.
population. Wow. What about other countries?
Worse. Russia is awful. Northern Europe is awful. Canada is right in the American flyway for the birds, and up those flyways is terrible. The Prime Minister of Canada 8 years ago was screaming at the CDC, why aren't you paying attention to this? It's awful all over the world. It's everywhere that you look, people have Lyme now.
And what do you see as the future? Like, do you see that at some point there will be a cure, or what's
Well,
your?
I think the fact that NBC decided to do 5 hours on it is great. I think that people are talking about it more and more, and I think that eventually, I'm constantly working on getting physicians to train. I was at a medical marijuana meeting in Columbus last year, and after it was over, I made some comment about Lyme and found myself surrounded by doctors who wanted to know how to train. So I think that we're going to see more doctors, and I think that the doctors who do it are going to get better at not spending so much money.
Unbelievable. How would I, yeah, for myself, if I wanted to become more informed, or how would I do that, sir?
I don't know anybody who talks about Lyme the way I do. You can look for things up on the Institute for Lyme and Associated Diseases, that's ILADS, and they will give you a map and send you to doctors, inside your zip code. Most of them are putting in constant IV lines. Some people are treating orally but not following a GEMSEC protocol. Not many people seem to know about the Booner protocol. Almost no one's talking about nattokinase.
The Booner protocol is the one where you're varying the antibiotics. And
No,
the
that's a GEMSEC protocol. The Booner
That's GEMSEC.
protocol comes from Stephen Booner, and Stephen Booner wrote a book called Herbal Antibiotics, Natural Alternatives for Treating Drug-Resistant Bacteria. He's a PhD who's become a Lyme specialist author, and he's how I found out to use LB Core.
Okay. Wow. Amazing. There's a lot. There's a lot here. It sounds like this is really an evolving science. I mean, it seems like right now a lot of the doctors, like what are they? What are the doctors in school, in medical school? What are they being taught about this?
They're being taught by the Infectious Disease Society of America, which is what all infectious disease doctors are, that Lyme is not chronic, that if you just take 14 days of doxycycline, you'll be cured for life. And
That's
if you
what I've
come
heard.
back and don't get better, they say you have chronic fatigue syndrome, and then they ignore you.
Okay. You know what? And I have to say, probably about 20 years ago, I noticed in my practice a lot of patients were coming in with this new diagnosis of chronic fatigue syndrome, and it didn't seem it seemed more of a doctor's impression of anything than anything that was really based in necessarily fact or any tests for it or something like that.
Yep.
So it goes along pretty much with what you're saying, Dr. Nielsen. As we wind down our segment, I always ask the doctors what they feel the holy grail of health is. So I'm going to just pose that question to you. What do you consider to be?
I consider the holy grail of health to be kill all the attorneys, to quote Shakespeare, get rid of insurance, stop Medicare, make everything catastrophic health insurance with a $10,000 deductible, and return to cash.
You think that would actually bring the cost down? You'd bring it back to more
Well,
realistic.
you can buy lab in my office for 5 cents on the dollar. People don't realize I can get an MRI for $325. If you know where to go, and you go to people in a cash economy, medicine is very cheap now.
Wow. And it's the opposite of what you would almost hear through the media, through the insurance companies. Obviously, a lot of people, I guess, are making a lot of money just with that different perspective.
Yep.
Wow, Dr. Nielsen, what a wonderful interview, and thank you. This information is really powerful. I'm so glad I had you on the show, and it's something I myself have to really study more and learn more about. How would people that want to get in touch with you, want to learn more, how would they do so, sir?
Gee, I don't want them to get a hold of me. I'm going to retire.
Oh, okay. All right. Fair enough.
I'm 67 years old. I don't even buy green bananas.
Understood. Well, I guess then the area you told us some contacts before, that would probably be the best way to research it and stuff.
Yep, correct.
All right. Sounds great. Dr. Nielsen, I want to thank you, sir, for being on the show. Greatly appreciated.
Thank you.
This episode is sponsored by New Jersey Foot and Ankle Center in Oredo, New Jersey. Remember, when you have a foot problem, you've got a foot doctor in the family. Weekend and evening appointments are available. Call us at 201-261-9445. Once again, that's 201-261-9445. Thanks for listening. Check out the show notes over at drdanspeaks.com. If you're loving the show, head over to iTunes and leave us a review, and we'll catch you next time.